Hi everyone, just a quick presentation regarding the current case that I presented about fish oil. The reason I have chosen this topic is that there has been two recent very large publications, both randomized trials in this regard, which has caught so much attention. As you know, fish oil is a multi-billion-dollar industry. There are advertisements everywhere that fish oil reduces cardiovascular events, but none is proven. We know that fish oil can reduce triglyceride, but no studies have proven that this reduction in triglyceride levels will translate into reduction of the cardiovascular events. Supplementary fish oil contains two main components, which are eicosapentaenoic acid, which is EPA, and docosahexaenoic acid, which is DHA. Many people believe that most of the beneficial effects that come from fish oil are actually due to EPA, and DHA is actually harmful, although this is not proven. So they decided to make a substance which is only EPA, basically purified EPA with no DHA, and they tried to test the hypothesis that if we use EPA only in high doses, that could reduce cardiovascular events. So the substance was called Vascepa, which is a trade name for EPA, purified EPA, and the trial which was performed called REDUCE-IT. REDUCE-IT, I should say, before going to explain the trial, I should mention some differences between this Vascepa or purified EPA and over-the-counter fish oil. Purified EPA is a prescription medicine, and it is 4 times stronger than the over-the-counter fish oil. This is important because the dose that was used in the REDUCE-IT trial was 4 grams daily. It means that if we want to use the over-the-counter fish oil to achieve those EPA levels in the blood, we have to use a substantial amount of over-the-counter fish oil, which is 16 grams daily. So when we are talking about fish oil in REDUCE-IT trial, you should remember that we are talking about this purified and much stronger substance, which is Vascepa. So REDUCE-IT trial was published in January 2019 in New England Journal of Medicine, and it was a large multi-center randomized trial which just over 8,000 patients. The baseline characteristics of these patients are important. These are all patients with established cardiovascular disease, or there are patients with diabetes who had other risk factors for cardiac disease. They were all receiving statin, and their fasting triglyceride level was between 1.5 to 5.6, and fasting LDL level 1 to 2.5. So basically, high-risk cardiovascular patients on a statin with good LDL control. I should mention none of these patients were on ezetimibe and none were on PCSK9 inhibitors. They randomly assigned them to two groups. One group got 4 grams of purified EPA, and the other group received mineral oil as placebo. After 4.5 years, there was a whopping 25 to 30% relative risk reduction in cardiovascular events. This is important that you should consider all the prior trials. They were not able to show even a hint of reduction in cardiovascular events, and suddenly we had a trial which showed 25 to 30% reduction in cardiovascular events by using EPA. Was it just due to reduction in triglycerides? If you look at the triglycerides at baseline, they were like 1.5 to 5.6. So during the trial, they came down maybe to about 3 or 4 millimole per liter. So reduction in triglyceride wasn't huge. So the investigators tried to come up with some explanations, and they said maybe the EPA has some anti-inflammatory effects, maybe it has caused regression or stabilization of the coronary plaques, or maybe it is causing cell membrane stability or improvement in endothelial dysfunction, but all of them maybe, because none is proven. After this, another trial came out, which was a STRENGTH trial. The secondary analysis of this trial just published very recently in May 2021, basically last month. As you can see, the STRENGTH trial was also a very large, multi-center, randomized trial with over 13,000 patients. So both of them very large trials. Patients had established cardiovascular disease, and all were using statin exactly like REDUCE-IT trial, but the substance they used here was called EPA-NOVA. This specific substance had EPA as well as some DHA. If you remember, they used Vascepa in REDUCE-IT trial, which was only EPA and no DHA. What did they use in placebo group was corn oil. But the results of this study were interesting because after 4.5 years, the study was stopped due to futility. So two very large randomized trials, very well designed trials, one significant reduction in cardiovascular events and one stopped for futility. So they have tried to come up with some explanations as why this has happened. Some said, maybe because in Vascepa we just use EPA and no DHA, and in STRENGTH trial there was some DHA also present in the substance, but many analyses were done and no harm, basically no harm was found from DHA. The other more plausible explanation was that, as you recall, the placebo which was used in REDUCE-IT trial was mineral oil, and the one in a STRENGTH trial was corn oil. It was noted that in REDUCE-IT trial, the patients had 30%, about 30% increased CRP, they had increased LDL, and they had increased ApoB. All of them after receiving mineral oil, and this was not observed with corn oil. So the hypothesis is that many people believe that the mineral oil that was used in REDUCE-IT trial actually increased the cardiovascular events in placebo group, and the results from REDUCE-IT trial are actually false positive, which sort of makes sense. It is very important to notice that both trials showed significant increase in hospitalization and development of atrial fibrillation, and also REDUCE-IT trials showed slight increased bleeding risk in EPA treated patients. So considering all these evidences, going back to our case, 7-year-old lady with paroxysmal AF, hypertension and diabetes, who is asking you whether she should take fish oil or not based on the current very conflicting evidence, my answer would be no for this lady, because there is no proven benefit and there is a hint of harm from EPA, especially in this lady who has paroxysmal atrial fibrillation and currently stable in sinus rhythm. So definitely there are more studies needed in this territory, and the comparators that used, i.e. mineral oil and corn oil, could be the possible explanations for the huge differences in results. Thank you very much for your attention.